Hi friends, I am Harshavardhan. Today I am going to explain on a topic of drug absorption and the influence of various physiological factors affecting this drug absorption. The drug absorption into the systemic circulation, that is into the blood, is dependent on various factors like the physicochemical properties of the drug and the nature of the drug product, how it is, and the anatomy and the physiology of drug absorption site. The drug absorption can be done in various ways, and it depends on the administration, how we give it to the patient. It can be given through intravenous or intramuscular, subcutaneous, oral route, or many other ways. So here I will give some brief idea on various administration routes, their advantages and disadvantages here. Firstly, we shall go into the IV bolus. Here there is 100% systemic absorption because we directly give the drug into the intravenous, and as we know that the drug should be acting into the body at the target site, it should reach the systemic circulation. So as we are giving directly into the intravenous route into the blood, so there is 100% systemic absorption, and there is bioavailability is very instantaneous. So there is an immediate effect because we are directly going into the bloodstream, and we should not forget that there can be a chance of anaphylactic reactions. The other one is IV infusion method. Here there is 100% systemic absorption like IV bolus, but here there is a controlled absorption rate and the plasma drug levels are controlled, and we can inject larger volumes of the drug. It is suitable for some poor lipid soluble and irritating drugs. The few disadvantages in this is that a person with a skillful person who can set the needle into the vein properly has to be there, and there is a chance of tissue damage at the injection site. The other one is intramuscular. This method is very rapid, and if we are giving an aqueous solution, and there is a slow absorption if we are given a non-aqueous solution. And when compared to the intravenous, it is very easier to administer the drug. And few drugs can be painful when some of the drugs like irritating drugs can be painful when we inject into the muscle. The other one is subcutaneous injection. Generally we give the insulin injection through this way, and there is an immediate effect from the aqueous solution and slow absorption from the repository formulations. The rate of absorption is also dependent on the blood flow at the injection site and the volume of the drug given through the injection. There are few more methods of administration. The other one is buccal or sublingual method. Here there is a rapid absorption from lipid soluble drugs, and there is no first pass effect because the drug is taken through the oral route and put under the tongue, and the drug doesn't pass into the stomach, so there is a bypassing of the enterohepatic circulation, and there is no first pass effect. The drug metabolism can be reduced, and the parent drug can be directly taken into the blood. So there is a higher chance of there is a decrease in the degradation of the drug, and this can be used for drugs with high doses. Can't be used for high doses. Generally nitroglycerin is used in this way so that it can be given to the patient and for an immediate effect. The other one is oral dosing, oral administration. This is very common. Everyone might have taken these tablets or capsules through this way. The absorption is varied from different tablet forms or different administration forms. when compared to the IV and intra IV or IM methods, the absorption is a little bit slower, and generally it is the very safest administration when compared to many other route of administrations, and it can show some erratic absorption. The other way is rectal administration. Here the dosage forms like enema can be given through this method for local and systemic effects, and there can be some a little bit of patient discomfort, and the suppositories can also migrate to different location. So these are some few disadvantages. The other one is transdermal. There is a slow absorption rate in this method, and the rate can be increased. The absorption rate can be increased for occlusive dressings, and the advantages are it is easy to use. We can put the patch on our skin, and the drug would slowly get absorbed through the skin. It is used for lipid soluble drugs with low dose and low molecular weight. Sometimes there are some irritation seen by this patch, and permeability of skin with age, gender and site absorption varies with cream or ointment base. And the other method is inhalation and intranasal. There is rapid total absorbable doses. There is a rapid action here, and the total absorbed dose is variable. This is used for local and systemic effects, and here the particle size determines the placement, and it can stimulate the cough reflex. And why few drugs cannot be given orally? Because there are some drugs which can, if they are taken through oral route, they can be degraded by the stomach enzymes or intestine in the intestinal enzymes. So that is why few drugs are avoided through this oral route. The examples are erythropoietin and somatropin. These are given intramuscularly because they can be degraded into the stomach when they are taken to the oral route. Erythropoietin is a hormone which is responsible for the production of red blood cells, and somatropin is a human growth hormone. Insulin is also administered through the subcutaneous route because whenever it is taken through the oral route, they can be digested by the stomach gastric acids and the stomach enzymes. And the biotechnological products are very labile, and they cannot be given through the oral route. So what is the actual purpose of drug? We give it through various ways. So what is the main thing which we actually want to see for a drug which we take? Whatever the route we take, through the intravenous or intramuscular anything, it should finally reach the systemic circulation, and from the systemic circulation it should pass to the target site, and where it actually show the pharmacodynamic action. So it should show the therapeutic efficacy. Excluding the intravenous route of administration, all other extravascular routes of administration the drug has to pass to the systemic circulation, and then it has to pass through the another it should act on the target site. So in order to absorb to get into the systemic circulation, it should cross some barriers. Those are cell membranes. For example, in the intestine, it should pass into it. The drug should be taken from the intestine, and from the intestine it should pass to the systemic circulation. So the cell membrane acts as a barrier for the drug absorption. The drug, if it is lipophilic, it can be easily traversed into the cell membrane and pass into the systemic circulation. But the water soluble drugs cannot easily pass through the membrane. and it also dependent on the size of the drug molecule, and depends on the ionization of the drug molecule. The highly charged ones cannot easily pass through the membrane. And the drug transport can also be taken by two ways. One is the transcellular transport, in which the drug movement is happened inside the cell, and the polar molecules cannot be able to traverse to the cell membrane. And few drugs some polar molecules can be transferred through the cell membrane through the paracellular transport, that happens between the cells and between the tight junctions. Water, some selected molecules, and lipid soluble molecules can easily pass through the membranes, but few highly charged molecules and large molecules such as proteins and protein-bound drugs cannot pass through the cell membrane. Functionally, the cell membrane consists of a phospholipid bilayer, in which the hydrophilic ends are on the outside and the hydrophobic tails are in the middle, in the inside. On the end, the plasma membrane encloses many cell organelles like mitochondria and many other endoplasmic reticulum and so on, and so many others. And it consists the pores and protein channels in which the ions can pass through this one, and the carbohydrates attached to the lipid molecules called glycolipids, lipid layer which are called glycolipids, and few carbohydrates can be bound to the proteins called glycoproteins. So this acts as a barrier to the many drugs. Generally, lipophilic drugs do not have any barriers to the drug diffusion. The cell membranes are not a barrier for the lipophilic drugs. And passive diffusion is a process of transfer of drugs from the higher concentrations to the lower concentrations across the membrane. Here there is no expenditure of energy, so that is why it is called as a passive. In this diagram we can see that there is a flux. The high concentration of the drug molecules are passing into the lower concentration. So whenever there is a difference in the concentrations across the membrane, the higher side of the concentration side of the drug molecules move forward to the lower concentration. So these are called the forward moving molecules. So there is always an equilibrium between the forward moving molecules and backward moving molecules. So when the concentrations on both the sides gets balanced, the forward moving molecules and the backward moving molecules would be the same. And here the arrow represents that the movement of the drug molecules is called as the flux. Passive diffusion is the major absorption process for most of the drugs. Here in this diagram we can see that there is a higher number of molecules on the extracellular space. Gradually, due to passive diffusion, the number of molecules into the intracellular space gets increased and there is a balance. According to Fick's law of diffusion, dq by dt is equal to dak by h into cgi minus cp. Here the dq by dt is the rate of diffusion, d represents the diffusion coefficient, a is the surface area, k is the lipid water partition coefficient, h is the thickness of the membrane, cgi means the concentration of the drug in the gastrointestinal tract, and cp means the concentration of drug in the plasma. So the rate of drug diffusion is directly dependent on the diffusion coefficient. Diffusion coefficient is a constant and this is defined as the movement of drug across a cell membrane in a unit area per unit time when the concentration is unity. The A is the surface area. The larger the surface area, the more the diffusion happens. The lipid water partition coefficient, the more lipophilic the drug is, the more easily the drug can be passed through the cell membrane. And H, the thickness of the membrane. The lesser the thickness, the more the diffusion takes place. So the rate of diffusion is inversely proportional to the thickness of the membrane. And here CGI minus Cp is the concentration difference between the gastrointestinal tract and then the plasma. As I have said that surface area plays a role in this drug diffusion, in this diagram we can see that this is a diagram of duodenal villi and microvilli. In the duodenum there are so much of villi and microvilli which makes a very large surface area. So that is why when the drug is given through the oral route, the drug gets absorbed very rapidly from the duodenum when compared to the other gastrointestinal tract areas. So here there is the villi which has a very large surface area, makes the drug to be diffused very easily. As I have said that the thickness also plays a role in the drug diffusion. The more the thickness, there is a less of the diffusion. In the bloodstream, when the drug should be passed through the other tissues, it should pass through the capillaries. So when there is a lesser thickness, there is an easier diffusion. But except in the brain, here the capillaries are tightly packed with the glial cells. So it makes it a little bit difficult for the drug molecules to pass through this barrier, as if there is a tight membrane existed, lipid membrane existed. So the hydrophilic molecules are very hardly absorbed through this layer, and some of the drugs cannot easily pass through this membrane because there are some tightly packed junctions. Sometimes the drug diffusion happens into the brain when there is an injury on the brain, or sometimes when there is a condition of meningitis where the meninges are disrupted. So then there is a diffusion taking place into the brain. Here the D, A, K by and H are all constant, so we can take all this into called as a P, which is called as permeability constant. And we can also get this equation in the other way, like this: dq by dt is equal to P into CGI. Why it is called only CGI? Because when compared to the plasma concentrations, the gastrointestinal drug concentrations are very high. So that is why we have taken the plasma as negligible, and so the equation comes as dq by dt is equal to P into CGI. Many drugs have both lipophilic and hydrophilic chemical substituents. So when there is a higher lipophilic substituents are there is a increased transport of the drug across the membrane. When there are higher hydrophilic substituents, there is a lesser transport of drug. Some of the few weak electrolytes are there in which the drug transport is dependent on the extent of ionization. The more ionized the drug is, the more charge of the drug is present, and the charged species cannot pass through the membrane. The non-ionized species can easily pass through the membrane. And it also depends on the pH and the pKa of the drug. pH of the medium and pKa of the drug. Henderson and Hasselbalch equation clearly defines the relationship between the pH and pKa. So for the weak electrolytes, in order to find out the extent of ionization and the ratio of the ionized species to the non-ionized species, I will just explain what is this pH is equal, what about this equations. From the Henderson-Hasselbalch equation, we can get the equation like this: pH is equal to pKa plus log of A minus concentration by HA concentration. We can rearrange this one into this like pH minus pK is equal to log of A minus concentration by HA concentration. And from here the ratio, the salt by acid concentration can be written as like this: A minus by HPA is equal to 10 power pH minus pK. Here the log is taken out, so the equation comes like this: is A minus concentration by HA concentration is equal to 10 power pH minus pKa. So taking this one as an example, taking this one as an equation, so we can calculate many drugs and weak electrolytes and their extent of ionization in different pH mediums. For salicylic acid, which is the pKa is already known, pKa is equal to 3. For example, if we take that in the pH 7.4, that is for example in the blood region, the extent of ionization can be determined like this: 10 power 7.4 minus 3 is equal to 10 power 4.4. So the value is 2.51 into 10 power 4. The same salicylic acid, when it is in the pH 1.2, that is in the gastric juice, the extent of ionization is 1.58 into 10 power minus 2. So there is a wide range of variation between the extent of ionization on the 7.4 and the 1.2. That is why the unionized ones are non-ionized species are very high in the gastric region. The drug can easily pass through the membrane. And here the total drug concentration on the 7.4 pH is higher when compared to the gastric juice and when compared to the gastric juice compartment. So this explains that the more ionization is seen in that compartment, there is an increase in drug concentration in that compartment. The lesser the ionization, there is a decrease in the drug concentration in that compartment. According to pH partition hypothesis, the drug ionizes to different degrees on respective sides of membranes. It depends on the pH of that compartment. Total drug concentration on both sides of the membrane are unequal. Compartment containing more ionized drug has more total drug concentration. And the drug has particular affinity towards different components. For example, dicumarol binds to plasma protein and digoxin binds to tissue protein. So a drug binding to the proteins, plasma proteins or tissue proteins would be not possible for the drug to be pass through the membranes and reach the target site. So it hinders the drug targeting. So in this way, the affinity to the plasma proteins or tissue proteins would reduce the absorption into the target site. Chlordane partitions into the adipose tissue, and tetracyclines will form complexes with the calcium on teeth and bones. In the intestine, many drug substances can be transported into the systemic circulation through the diffusion pathway or through the carrier-mediated transport. Here, active transport is a system in which there is an expenditure of energy. There is a movement of drug molecules from the low concentration to a high concentration, that is against the concentration gradient. So that is why it requires energy. Some of the few lipid insoluble drugs like 5-fluorouracil, it's a natural physiological substrate. It resembles the natural physiological substrate, so it is absorbed through this carrier-mediated transport. The carrier-mediated transport is nothing but the drug binds to the carrier it absorbs to the carrier, and then the carrier takes to the blood to the other side of the membrane, where the carrier dissociates, this drug dissociates from the carrier, and then it is transported into the blood. So the drug only absorbs to the carrier. So when the drug is having that particular affinity and the structural similarity to the carrier receptor, then this drug can be bound to that carrier and then be taken to that other way. As the carriers are present in the membrane, there is a competition taking place between the natural substrates to the drug molecules. So there is always a competition. So the higher concentrations are given, there would be a limit in which there would be a saturation. Here in this diagram we can see, when compared to the passive diffusion, there is a linear relationship in the passive diffusion. In this active transport, as the carrier mediated transport, in the carrier mediated transport, there would be saturation, and at some point it becomes a saturation, and it becomes a ceiling limit. It is shown as an arc, but in the passive diffusion it is a linear relationship. Facilitated diffusion is another kind of carrier mediated transport in which the diffusion happens without an energy expenditure, because the transport of drug molecules happens along a concentration gradient, that is from high concentration to the low concentration. But the carrier isn't involved, just like how we saw in the active transport of the carrier mediated transport. So we can see the competition kinetics over here as well. Few of the carrier mediated intestinal absorption transporters are here. Some of the drugs are transported through these transporters in the intestine, like amino acid transporter, oligopeptide transporter, phosphate transporter, bile acid transporter, glucose transporter, P-glycoprotein, efflux, monocarboxylic acid transporter. The P-glycoprotein is present in the intestine, and this is useful in efflux, as an efflux pump with the drugs like cytotoxic drugs, or some of the drugs are sent out from the blood into the lumen of the intestine. And most of the oral cephalosporins are transported through the amino acid transporter, except the cefazolin, which is a parental drug, because cefazolin cannot be transported through this amino acid transporter to the significant degree. That's why it is used as a parental mechanism. Vesicular transport is also one type of process which is happened through phagocytosis or pinocytosis. Pinocytosis is a process in which there is an engulfment of solutes or smaller solutes or fluids from the extracellular space into the cell. It forms as a vesicle and taken up by the cell. The phagocytosis is a process of engulfing the larger particles from the extracellular surface and then taken into the vesicle, taken as a vesicle inside the cell. It is actually seen with the help of macrophages. Few drugs like oral Sabin polio vaccine is actually transported through this endocytosis pathway, and exocytosis is the process of forming of the transport of drug from the cell inside the cell to the outside. It forms as a vesicle actually in the cell with the help of a plasma membrane, and then it fuses to the cell membrane and then gradually gets out of this, releases the drug from the plasma membrane through the exocytosis. Actually, insulin is released through this pathway from the cell membrane, and insulin granules are released from the pancreatic cells. Here there is a diagram in which there's a brief idea on what the phagocytosis and pinocytosis is. In the extracellular surface, there is a solid particles taken up by the cell membrane, and the cell membrane gets invaginated like a pseudopodium, and then it is taken inside the cell as called as a phagosome. In the pinocytosis, the in the smaller solutes are taken just the same way as the plasma membrane invaginates, and it forms as a vesicle into the cytoplasm. The other kind of transport is the pore transport, or called as the convective transport, in which the very small molecules like urea, water and sugars can easily pass through the cell membranes rapidly, as if the membrane contains some channels or pores. Although these channels are not directly observed by microscopy, but this model of this drug permeation is actually helpful for us to explain the renal excretion of drugs and the uptake of drugs into the liver. The other kind of transport is the ion pair formation. Actually, few strong electrolytes can get ionized at any pH level. So when it gets ionized, there is a decrease in the drug absorption. So when the highly ionized drug, whatever it may be, when the charged ions are complexed with the other opposite charge, they becomes as neutral. So that neutral complex can be easily transported into the cell. In that way, actually propranolol can be is complexed with oleic acid, binds with oleic acid, and the quinine is bound to the hexyl salicylate. So thank you very much for watching the video, and please subscribe to our channel.